Lecture 4, which is the respiratory system. It's relatively simple compared to the other ones that we have been doing in the unit. So hopefully it's not going to be too challenging when you're studying for the tests. So first part here, list all the structures that air passes through to go from the air to the site of gas exchange. Okay, so site of gas exchange here, that's where the oxygen is going to go in your blood and the carbon dioxide is going to go out of your blood. And this happens at the alveoli. Okay, alveoli. So circle all the structure that are part of the upper respiratory tract and circle all the structures that are part of the lower respiratory tract blue. Starting at the nasal cavity, right? You inhale and the air will go in through your nostril. It will go through the nasal cavity. And then it's going to go to the pharynx. Okay, so the pharynx is the back of your throat, basically. Then you're going to go through an opening called the glottis, which then leads to the larynx. Okay, the larynx is also known as the voice box. And from there, it will go to the trachea. And now we're in the lower respiratory tract, right? Lower respiratory tract is blue. Upper respiratory tract is red. So all these things are part of the upper respiratory tract. And then once you cross the larynx into the trachea, that will be the lower respiratory tract. The trachea will basically go down, right? And then it will split into the left and right bronchus. So B-R-O-N-C-H-U-S. Bronchus is singular. Bronchi, C-H-I, that will be plural. And so you would have the main bronchi, right? Which is also known as the primary bronchi. Each of these bronchus will lead into the lungs, right? The left lung and the right lung. And inside the lung, it will continue to split, right? So that's the main one. That's the primary one. And when you split it one more time, it becomes the secondary. And when you split it again, it becomes the tertiary. So all these are bronchus. And from there, eventually, it will keep on splitting and splitting and splitting. It will become very, very small. And we get the bronchioles. And at the end, at the terminal end of the bronchioles, that's where you will find the alveoli, the site of gas exchange. Right? So this will continue to split a couple more times, right? And if I zoom in here, at the very, very end, you will have a very narrow airway. That's approximately 1 millimeter in diameter. And then at the end, you would have some cluster. Right? That would be your alveoli. Okay, alveolus in this case, singular, and that's the site of gas exchange. Right, so that's a pathway by which air is going to go from the air, from the atmosphere, all the way to inside your lung, to the location of gas exchange. All right, briefly describe the anatomy and functions of each of the following structure. So the nasal cavity, let's start with that. Nasal cavity is basically the immediate area inside your nose, and it actually is quite big. And the nasal cavity is responsible for warming. So it warms, moistens, and filters the air that we breathe. Okay. It warms it and moistens it because there are mucus lining inside, and these mucus linings are going to be very rich in capillaries, and so that allows you to warm the air and add a little bit of moisture to it. And all those hair inside your nose, that will help with the filtering part of the nasal cavity. Okay, so the nasal cavity also leads to 4 sinuses. Okay. And the sinuses are located, like for example, here that's a frontal sinus, and then you have your ethmoidal sinus, right? It's named after the bone that it's being found in. Let me just quickly show you a picture of it. You don't have to memorize the name for now. Just gonna show you where it is so you understand. So this is a cross section, like a mid-sagittal section of your head. And over here, right? That's the frontal sinus. That's one of them. You have another one here called the sphenoid sinus, which is inside your sphenoid bone. And so this whole area over here, that's the nasal cavity. Okay, so it's really big, right? Like this is your nostril. Like if you pick your nose, you're only going to be able to touch this part, right? It's really, really deep inside. That's where your nasal cavity is. So when someone has like a COVID swab, right? They stick their the Q-tip, right, all the way, right, inside to get a sample, right? So that's how deep it is and how big the nasal cavity is. Does that make sense? Okay. So that's the nasal cavity. And then we go to the pharynx, right? The pharynx is the common passageway. The common passageway for food, liquid, and air. So anything we swallow, anything we inhale is going to pass through the pharynx. It's basically like the back of the throat, right? The throat, we can say. Right? The throat. Again, but with the workbook, it's like the workbook that you brought, right? Is that what you mean, Mohammed? Yes, I feel like we run into this problem every week. Yeah. So the workbook, unfortunately, is a little bit older version. But these extra charts are very simple to just copy. On a piece of paper. So if you could do that, that would be great. And do apologize. But the core information is still there in the workbook. Okay. All right. So the pharynx, let me just go to the diagram and explain to you again over here, right? So this whole thing is the pharynx, right? And there are two ways to go into it. If you're breathing air, it's gonna go again through the nostril, through the nasal cavity, and then it's gonna go into the pharynx through this opening here. And so this opening is called the nasal pharynx. Okay, I labeled this already in the video, okay, but just in case you missed it, you can go into the pharynx, the throat, through the nose, basically, okay? That's called the nasal pharynx, okay? You can also go into it through swallowing, okay? So if you swallow some food, it's gonna go into the throat through F, right? And that would be the oral pharynx. Okay, so two ways to go into the pharynx. And if we're talking about air, right, then the air is going to go down your trachea, right? It's going to go down your windpipe. And to go into that, you're going to go through another opening called the laryngeal pharynx. Okay. So air goes through the nasal pharynx into the pharynx, out of the laryngeal pharynx, and into your trachea. Okay, so the two ways in, technically is two ways out as well, right? Food is going to go down the esophagus, air is going to go through the trachea. All right, but we don't have a name for the opening that goes into the esophagus. Okay, you see the esophagus? The esophagus is back here, right? That's the esophagus. That's where the food goes down to. Everything else you can check the videos to label, but that's pretty much it in terms of the pharynx. Okay. So let's go back to here. and write down what we talked about. Okay, so anything we swallow goes into the pharynx through the oral pharynx. It's an opening, right? And here, oh, sorry, constantly run out of space. Let's make it a little bit smaller here. There we go. Can you guys see? I hope you can still see that. Okay. And then anything we inhale goes into the pharynx through the nasal pharynx, right? Okay. That's that. It's all in the PowerPoint slides anyways, but it's always good to write it down, you know? Okay. The larynx. The larynx is basically your voice box, right? Okay, so contains vocal cords for producing sound. Okay, when air moves through your airway, the vocal cords vibrate, and that's how you're able to talk, right? Do you guys hear that buzz? Oh boy, hold on, give me a second. Oh, there we go. I think maybe someone's mic was going haywire. Are we okay now? Okay, I think it's fixed now. Yes, so to produce sound, you gotta move air through your airway, right? So if you pluck your nose, go ahead and try this. Right? If you pluck your nose and you close your mouth, okay, and you try to hum a song, right? Hum your favorite tune, you won't be able to do it. Okay, give that a try, right? That's because if you plug all the openings, air is not going to be able to come out, and that means there's no air moving through the vocal cords. They can't produce sound. That's why if someone is choking, if their airway is blocked, they won't be able to say anything. They won't be able to talk. They won't be able to breathe because nothing goes down, nothing comes out, right? So it contains the vocal cords for producing sound, and the opening to the larynx is called the glottis. Okay, glottis. All right, next we have the epiglottis, which is an elastic flap. Elastic flap that covers the glottis during swallowing. Okay, so if you put your hand on your throat and you swallow, you can feel something pushing up, right? So that's basically your larynx pushing up. So the larynx pushes up against the epiglottis to create a seal when we swallow. Okay, and that's important. Right? You don't want the food to be going down the wrong tube, as they say, right? The wrong tube would be the trachea. So you want to cover up the trachea, the opening to the trachea, when you swallow. Okay, so the epiglottis itself, that doesn't really move. It's some people think it's like a toilet seat, goes up and down, but it doesn't. It stays in place, and it's your larynx that goes up and creates the seal when you're swallowing. And again, you can feel that when you put the hand on your throat. Okay, that is that. Next we have the trachea. Right? Trachea is the windpipe. The windpipe. Okay. It is in front of or anterior to the esophagus. Okay. It is protected by C-shaped cartilage. If you put your hand here and just gently go up and down, you can feel the ridges of the C-shaped cartilage. Okay. The interior of the trachea is lined with ciliated cells, right? Ciliated cells, right? And what's the name of the cell that produce the mucus? Does anybody remember? It's the name of the cells that produce mucus.
Goblet cell.
Thank you. That is the goblet cells. Goblet cells. Okay, I think it's capital G. All right, so these are the two types of cells that you will find on the inside of the trachea. And obviously together, right, they help trap dust particle and sweep them out, right? They help trap some pathogens, sweep them up. It's part of your physical defense, right? Physical barrier. The trachea then split into the bronchus, right? So that is split from the trachea. The left and right bronchus lead into the left and right lung, where it will continue to split. Okay, so as I show you earlier, the main bronchus is going to split into secondary and then tertiary. Keep on splitting. It looks like an upside down tree, okay, where the branches are representing the various levels of the bronchi. Also lined with ciliated cells and goblet cells. Protected by cartilage ring. Right? So no longer are the rings C-shaped. It's like a full ring now, a full ring, because there's nothing behind the bronchus, right? The trachea, behind the trachea is the esophagus, so you don't want to constrict the esophagus. That's why the cartilage is just like a C shape rather than a full ring. But there's nothing behind the bronchus. That's why we can have the full ring. All right. That is that. That's the bronchus. All right. Then we have the bronchioles. Bronchioles are very, very small. Okay. The smallest part of the airway Okay, approximately 1 millimeter in diameter. A millimeter is the space between two lines on your ruler. Okay, very, very small. They do not have cartilage rings. Okay. Therefore, they are collapsible. Might collapse. Okay. During an asthma attack, for example, they might collapse and make it difficult to breathe. Okay. E.g. asthma attack. All right. Each bronchiole ends with an alveoli cluster. Okay, just like what I drew you, right? At the terminal end, you're gonna have an alveoli cluster. And all these are gonna be surrounded by like blood vessels, right? Where you're gonna reoxygenate your blood. Okay, next we have the alveoli themselves. The alveoli, they are site of gas exchange. Okay. They are surrounded by capillaries. Okay. So at the alveoli here, O2 enters the blood and CO2 leaves the blood. Okay. Now there is a special type of cells that are found in the alveoli that creates an oily secretion. Anybody remember the name of those cells? Just checking here. Just want to see the type of cells that creates an oily substance in the alveoli. What is that? That's okay. And that's the septocells. Septocells creates surfactant. Right? And we'll talk more about it. But basically, this oily substance allows the alveoli to open up. Right? Without surfactant, then the alveoli will collapse, making it difficult to inhale. More on that later. I think I have a chart coming up for that. Okay. Next, the pleurae. What is the pleurae? Anybody want to explain to me what the pleurae is, rather than me doing all the explaining? Anyone want to tell me where you find it?
It's like double layer of membrane.
Yeah.
Around the lung.
Exactly.
By the lung, yeah.
Exactly. So thank you very much. Let's write it down. Okay, so the pleurae is a double layer membrane surrounding the lungs. Okay, so let's just try to draw this out for you. There is your lung, one of them anyways. Okay, you're gonna have the other one on the other side. All right. And so the pleurae has two layers. We have the layer that is immediately touching the lungs, right? that would be the visceral pleura. Right? That name should be familiar to you, right? We sort of use the same term for the heart membrane, right? Visceral pleura, right? That is in contact with lungs. Okay. And then there is an other layer, right? That's outside of it. That's like this layer right here. This is not drawn to proportion, of course. Right? There's a second layer here. So what do we call the blue layer here? What is that called?
Parietal pleura.
Yes, thank you. So that's the parietal pleura. Right? That is not in contact with the lungs, is outside of the visceral pleura, but this one would be in contact with the diaphragm at the bottom, for example, and inner chest wall, right? The inside of your chest. Okay. Now I don't have space to write down more stuff here, but it's in the PowerPoint slides. So the two layers of the pleurae is it's plural, okay, and singular is pleura, okay, and so the two layers basically allows the movement of the chest and the movement of the diaphragm to be translated to the movement of the lungs. In other words, when your rib cage move out and in and out and in, it will pull the lungs with it. Same thing, right? Your diaphragm is either dome shaped like this or flat like that, right? So when it moves up and down like that, your diaphragm, right, it will pull the lungs with it. Okay, so the purpose of the pleurae is, you know what, maybe I'll write down. The purpose of the function of the pleurae is to allow the motion, the movement of the lungs to be tethered to the movements of the rib cage and diaphragm. Right? Tether, right? Like you pull it along, right? So again, right? When your rib cage move in and out, when your diaphragm goes up and down, it will pull the lungs along with it. And that's possible because of the pleurae. Okay, so if you damage the pleurae, let's say there is a stab wound or something, then your rib cage will move out, right, and in and out, but you won't be able to pull the lungs with you, and you won't be able to breathe, at least not on the side that has the puncture. Okay. Now, there is something else between the blue layer, the parietal layer, and the visceral layer. There is is a fluid, and what is the name of that fluid? Got some fluid right.
Suffocating pleural fluid.
That's right. That is the pleural fluid. Okay, pleural, P-L-E-U-R-A-L, fluid. Okay, so that creates surface tension that glues the two layers together. So when the blue goes, it'll pull the green with it, and then it will pull the lungs along with it. I hope I'm making sense here. Okay. You know, it's kind of cold today, right? So some of you might be wearing like 2 layers of clothing, like I'm wearing 2 layers. So the outer layer, right? That's like the parietal, and then, you know, if you have another shirt inside, that's like the visceral, right? The one that's touching your skin, right? And the space between the 2 layers of clothing, that's where the pleural fluid is going to be. Okay. All right. Let's see. Do we have some polls here? We do. I forgot to erase it. Sorry. Close your eyes. Close your eyes. Don't look at the answers. Okay, give me a second. Just gonna erase all of them. There we go. Okay, let's try some of these questions. Fairly straightforward. Where's the poll button? Go ahead. Oh, sorry, I launched the wrong poll. I have a tendency to do that. Let's try again. This one is multi-select. You can choose more than one answers. Yeah. Okay, not bad, not bad. Just gonna leave it at that. So lower respiratory tract, basically trachea and beyond, that's lower respiratory tract, right? And the answer would be, the trachea, the bronchus. Okay, so these are the two answers. And so when you have a lower respiratory tract infection, it takes a longer time to recover from. Right? It's usually more damaging than like an upper respiratory tract infection. So upper respiratory tract infection will be like, if you have a sinus infection, if you have a cold or something like that. Lower respiratory tract infection would be like, tuberculosis, pneumonia, right? And even COVID can give you lower respiratory tract infection. Okay, next one. So the correct answer is the hard palate. If you stick your tongue up right now in your mouth, you will feel something hard, right? That's called a hard palate. It's made up of two bones, and it separates the oral cavity, basically the inside of your mouth, from the nasal cavity. Okay. Uvula is the thing that's dangling at the back of your throat. Like if you look into the mirror, right, there's a little dangling thing right there, right? Like let's say this is your tongue, right? That thing, that's the uvula. What's the function of the uvula? Anybody remember from lecture?
It's like prevent food go back to the nose.
Exactly. Yeah. So when you swallow, the uvula will seal the nasopharynx so that food doesn't go up to your nasal cavity. Okay. Like if you try to laugh and swallow at the same time, sometimes food will end up in your nose, right? I'm sure we had that experience. Okay, we'll come back to the next one. Let's label this one. I know this one is also not in the workbook if you purchase one. Sorry about that once again, but we will label it together. Okay. This is basically the neck area here, right? What the inside looks like, and we have a structure here. Okay, that is the epiglottis. Okay, which again will seal the opening, the glottis, when you're swallowing. We cannot see the glottis here. The glottis will be like right behind here, right? There's gonna be like a hole here behind the structure. That's the glottis. Okay. And this whole thing is basically the larynx, and it's protected by several cartilage here. Okay, so we have a cartilage right up here. Okay, that one, it's the hyoid bone. Hyoid bone, or hyoid cartilage, hyoid bone, which is called bone. Okay. We have another one here. Again, you can feel it. Right. What do we call that one? Yes, Mavis, that is the thyroid cartilage. And it's more prominent in men, right? That's why there's the Adam's apple. My younger daughter was just asking me the other day, what's that thing on your neck? And I was like, oh, yeah, don't worry about it. I don't know what to tell her. There's another thing here. What about this cartilage right here? Anybody remember that one? Yes, Donna, that is the cricoid. Cricoid cartilage. Right, so all of these things like provide attachment points for some of your connective tissues, and they provide stability for your throat. Okay, now these little rings down here, right? That would be the cartilage rings, right, surrounding the trachea. Okay. And basically this whole area, right? That's like your larynx, right? Okay. Just very quickly here. Which of the following protects the larynx? So we just did it, right? There is the hyoid bone, there is the thyroid cartilage, and then there's the cricoid cartilage, right? All these things. Okay. I think we can do the next one as well. Number 4. Okay. Anatomically correct. The visceral layer is superficial to the parietal layer. Superficial means like outside of it, right? And that is not correct. The visceral layer is going to be deeper, right? To the parietal layer, okay? Because it's touching the lungs. Trachea is posterior to the esophagus. That's also not true. It's supposed to be in front of it, anterior. Diaphragm is below the lungs, so it is inferior to the lungs. The lungs are lateral to the lung, to the hearts. Okay, so there are your lungs, and then the heart is in between, right? Okay, so that is the correct one. Okay. List 4 factors that affects airflow. You want to type something in the chat box? What are the 4 factors that affects airflow when it comes to respiration, when it comes to breathing. Yep, there's pressure gradient. Let me write that down. There's Boyle's law. 2 more. Yep, thank you, thank you. There's resistance and compliance. Okay. So these are not listed in any particular orders. In fact, they're not the same order as the slides, but doesn't matter. Okay, they're it's not like one is more important than the other. They all have role in affecting how air flows. So pressure gradient, basically, fluids is like liquid and gas, right? So we're talking about like air here. So air floats from high pressure to low pressure. So if you have 2 points that have different pressure, the air will go towards the side with lower pressure. That's how wind is generated, like outside, right? Okay, so if you are by the sea, right, usually the winds blow towards the land. That's because land have lower pressure compared to the sea, and the wind comes in. But with what we are talking about here, we are specifically interested in the pulmonary pressure, intrapulmonary pressure, the pressure inside the lungs, versus the atmospheric pressure. Okay, so PI, that's intrapulmonary, right, like within the lungs, right? Pressure. And then PA, that's atmospheric. Okay, so when PI is greater than PA, do you breathe in or breathe out in that situation? When the pressure is higher inside the lungs compared to the outside, do you breathe out? Do you breathe in? Which way does it go?
It's like inhale.
Okay, so good try. It goes from high pressure to low pressure, right? So if it's higher inside compared to outside,
Exhale, yeah.
exhale. Yeah, so this is exhalation. On the other hand, if PI is less than PA, the air will rush in and then you will inhale. Does anybody have any question about this? So we cannot change the atmospheric pressure. So PA is pretty much fixed. What we can control is the PI. Right? By changing the lungs volume, we can change its pressure. Right? And that's where the next law comes in, right? The next factor, the Boyle's law. So Boyle's law states that at constant temperature, okay, and within the body, temperature is like 37, so it's fixed. So at constant temperature, basically when you increase the pressure, when you increase the volume, the pressure goes down. And when you decrease the volume, the pressure goes up. In other words, there is an inverse relationship between volume and pressure. Okay, one goes up, the other comes down, as long as temperature is kept constant. Okay. Next, resistance. All right. So when the diameter of the airway changes, resistance to flow will also change. So let's say you decrease the radius, decrease the diameter. That equals to increase in resistance. Right. So during an asthma attack, as I talked about earlier, when the bronchioles collapse, that reduces the diameter and it makes it more difficult to breathe. On the other hand, if you increase the diameter, if you take like a vasodilator, bronchial dilator rather, like if you take a puffer, it causes the muscles to relax and opens up, increase the diameter, that will decrease the resistance. Okay. The last point is compliance. Compliance is the expandability of the lungs. Right? And this is related to the amount of surfactant. Right? If you think about like a plastic bottle, it's very difficult to inflate it, right? Like you can try to blow air into it, it just won't expand, right? So something like that has low compliance. Okay? We don't want our lungs to have low compliance because it would be difficult to breathe in. Okay? Something like a balloon, right? Balloon would have a high compliance, right? You can blow air into it and then it will get bigger and bigger quite easily, right? So we want to have a reasonable degree of compliance, right? But not too much. If it's too compliant, then it will expand easily, but it won't come back. So it will make it difficult to exhale. You just have to have the right level of compliance. So there you go. 4 factors affecting airflow. Okay, move on. Next, this talks about the relationship between surface tension and surfactant. Again, I explained this already in the lecture recording, but let's just briefly talk about it. Right, so here is the alveoli, right? Alveoli. Alveolus, if it's singular. Now, there are 2 conditions that are necessary for gas exchange to occur. Right? 2 conditions necessary for gas exchange, right? For efficient gas exchange. What are they? Anyone remember? What do we need in order for gas exchange to, okay, yeah, so Donna said water. Yeah, I'm going to rephrase that. There needs to be a moist surface. We don't want to be like, submerged per se, but we need it to be moist. Okay. And what's the other one? Doesn't necessarily have to be warm. I mean, like we could still breathe if it's, in the winter, like -40 outside, right? Okay, the second one is you need to have a large surface area. Okay, so your alveoli is shaped like a ball, like a sphere, and that is a perfect shape because mathematically speaking, a sphere is the shape that has the maximum volume to surface area ratio. Okay, it means that that shape, the sphere, will give you the maximum amount of surface area for the smallest amount of volume. So it doesn't take up a lot of space, but it gives you a lot of area to work with, which is ideal because we got to pack all these things inside the lungs, right? So we don't want it to take up too much space, and yet we want it to have large surface area. Okay, and we want the surface to be moist because the gas needs to dissolve before going into the blood, right? So there's a a thin film of water on the inside. So there's like water molecule here, right? And I'm sure you remember either from semester 1 in my class or from chemistry, water molecules are polar, right? And so they are attracted to each other, right? So this force that's created from the attraction of the water molecule, that creates surface tension. Right? So that is created by the attraction between water molecules. Okay. Remember, the oxygen is slightly negative and the hydrogen is slightly positive. So they act like tiny magnets that are attracted to each other, right? So that means if that's the only force that's present in the alveolus, then it's going to create a force that pulls the alveoli together, right? Imagine you have a shopping bag, like a plastic shopping bag, and you glue magnets on the inside. Right? What's going to happen? Well, the magnets going to attract each other and cause your bag to collapse, right? Okay, so that's what surface tension does. Right? It will cause the alveoli to close up. Now, is that a good thing? Is that a bad thing? Well, it depends what you're trying to do, right? Okay, so in terms of breathing in and breathing out, do you think the surface tension will help with breathing in, or do you think the surface tension will help with breathing out? Inhaling or exhaling? Which one does it help with? Okay, Tina said exhaling, right? And you know, she'd be correct. Because when it squeezes on the alveoli, all the air comes out, right? Okay, so surface tension, the effects of respiration, it will help with exhalation, breathing out. Okay. However, it will hinder inhalation. Okay, it will make it difficult to breathe in, because like you always want to close up. It takes effort to open it up again, right? And so we need a counteracting force to break the surface tension, right? And I mean, you don't have to take science to know water and what else don't mix together. Yeah, oil, right? Exactly. So earlier we mentioned something about the septal cells, and they will create an oily substance called surfactant. Okay, so created by septal cells in the alveoli. And these surfactant will basically break some of these surface tension. Okay, so you don't want the lungs to be too tight, in other words, okay? So the effects on respiration is that, number one, it increase lung compliance, make it more expandable. Now, again, right, like, is it good, is it bad? Depends on what you're trying to do, right? If it's more expandable, that means it will help with inhalation. But it will hinder exhalation. Right? So in other words, the surface tension maintains certain level of elasticity to your lungs. Okay, so you know, inhale gets bigger, and then the surface tension causes a recoil, and that will help squeeze the air out. Okay, and when you breathe in, the surfactant allows the lungs to open up. Right, so the two forces work in balance with each other to allow gas exchange to pretty much occur without much effort, right? Okay, so in the lecture notes, I talked about the respiratory distress syndrome, which is something that happens in premature babies, right? When they're born too early, their lungs haven't been able to make the surfactant just yet. And that caused them to have difficulty breathing, right? And so, you know, they need to inject some steroid into the baby, to the nose, right? That goes into the lungs when they come out, and that helps open up their lungs. Okay. That is that. Okay, circle the correct description for inhalation and exhalation. Let me just help you out with this, with a diagram. Okay, so this is an exaggeration, okay, to help you understand. So let's do inhalation. Okay, now, if you take a deep breath, right, like you feel that your chest goes up, right? Okay, but as I explained in the lecture, it is because your chest goes up first that enables the air to come in. Okay, so the chest must move before the air goes in. Right? When you breathe in, it feels like the air goes in, then your chest goes up, right? Okay, but it's actually the other way around. Right? The chest has to move first, and it creates the conditions necessary for the air to come in. In other words, if you have something heavy on top of your chest, right, and you cannot move your chest, then you won't be able to breathe. Okay. So inhalation, how does it happen? Okay, so this is like the person, and to breathe in, again, this is exaggeration, just so you can see what's really going on, right? Okay, so the chest will go out and up, and then the diaphragm will go down, right? So collectively, these actions will pull the lungs with it, and that's made possible by the pleura. Yeah, so rib cage goes up and out, diaphragm goes down and flat, right? It's a contraction, causes it to go flatten. And that pulls the lungs along with it to make it bigger. Now, Boyle's law states that if you increase the volume, pressure must drop. Right? So intrapulmonary pressure decrease. And when the pressure in the lungs is less than the atmospheric pressure, air rushes in, then you inhale. Okay, then you breathe in. Okay. Now, exhalation is the other way around. Okay, so here's your person again. And this time, right? Again, this is exaggeration. The ribcage comes down and in. Diaphragm goes back to dome shape, right? And together these action will compress on your lungs. Right? So it will decrease the lung volume, increasing the pressure. Right? So ribcage comes down, dome shape, pressure goes down. Volume goes down and pressure goes up. So when PI is greater than PA, air rushes out, and we are able to exhale. Okay. Do we have any question before we take a quick break? Everybody okay? All right, let's do 5 minutes, and we'll do more afterwards. See you in a bit. Hello, let's keep going. Match the following terms with its appropriate definition. So before we do that, let's take a look at this graph. I think I talked about this in the recordings already, but you know what? Let's just go through it again. So when you're just sitting there, you know, breathing in and breathing out, air goes in, your volume goes up. Breathing out, volume goes down, right? So your lung increases, decreases its volume as you breathe in and out. So that normal fluctuation, right? In and out like that, right? That is called a tidal volume. Okay, and that depends on the person, right? Some people are bigger than others, and so the tidal volume might be larger for some people than others. So this is the tidal volume. Okay. At the end of your regular inhalation, if you continue to breathe in until you can't breathe in anymore, so like all the way until you cannot breathe in anymore, that extra bit of air that we just breathe in, okay, that extra bit of air that we breathe in, that is called the inspiratory reserved volume, or IRV. Okay, so the full name, it's right here, right? Inspiratory reserve volume. Okay. Similarly, if you were to exhale all the way until you cannot exhale anymore, so like all the way, the extra bit of air that you breathe out, that is the expiratory reserve volume. Now understand this, even if you breathe out as much as you can voluntarily, your lung volume is not going to be zero. You're still going to have some air that's inside your lungs, and those are not going to be able to come out not voluntarily anyways. Okay. So if you add up all these volume, if you exhale all the way, okay, exhale as much as you can. So at that point, your lung is the smallest possible, right? And then you breathe in all the way until you can't breathe in anymore. So you basically go from the lowest point here all the way to the maximum point. That amount of air that you just breathe in, that represents your vital capacity. So vital capacity, VC, equals to inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Okay. That's what it is. So after you breathe out, right, I said there's still going to be some volume left in your body. Okay, so this volume here is called the residual volume. Okay? And this is sometimes called dead air. Dead air. It is very high in CO2, does not participate in gas exchange. That's why it's dead air. It just sits there and do nothing, just takes up space. The more dead air you have in the lungs, the less efficient you will be at gas exchange. Okay. So for example, right, let's just say these totally make up numbers just to help you understand. Okay. Let's say this is your entire lung, right? And you're able to use all this space, all these volume for gas exchange. But if you have some dead air here, right, then you would only have, let's say, 80% space for gas exchange. But if you increase the amount of dead air, right, then now you're down to, say, 60% volume for gas exchange. So the more dead air you have, the less efficient you will be at gas exchange. Does that make sense? Yeah, it's still air, but then that air has a lot of carbon dioxide in it, and so it doesn't play a role in gas exchange. Okay, and in fact, it never comes out. It just stays there and take up space. Okay. Another way to think about this is like, your vacuum bag, I guess that's one way of thinking about it. It's like there's always some dirt that's stuck inside, right, that you're not going to be able to empty, and so it will fill up the rest of the space is the available spot left, right, for filling it up. So if you have more dirt stuck in there, the less space you have to fill it up, right? And that makes the thing less efficient. That actually was a terrible analogy. It was a good analogy in my head, but after I say it, it was like, not too good. The point is the dead air is going to interfere with your gas exchange, and the reason it does that is because it's taking up space and it's doing nothing. Okay, so does the residual volume ever comes out? Yeah, it does. If someone has a lung puncture, right? Again, stab wound, that's one possibility. Or in some cases, if someone is in a car accident, for example, the force could be so strong it causes the rib cage to break, and the ribs can puncture your lungs. Okay, so when your lungs is punctured, the air comes out. That air that comes out is the residual volume. But even after you pop the lungs and the residual volume comes out, you will still have a little bit of volume inside. Okay, that is the minimal volume. Okay, like if you just leave a balloon sitting on the table, right? The amount of air inside is not zero, right? Like you can still see it's popped up a little bit, right? That's essentially what the lungs does. Okay, even if you get out the residual volume, you will always have a bit of air inside. That is the minimal volume. VC, sorry, TV. TV stands for tidal volume. Okay, Hammer. Hammer asks, the increase of percent of RV good or bad for body? Bad. Okay, so in emphysema, for example, emphysema is the it's one of the things that happens when a person smoke a lot. Okay, and this is basically caused by a damaged alveoli. Okay, and it leaves behind large empty spaces, right? Okay, filled with CO2, right? And when you damage the alveoli, you also have loss of elasticity. Okay, so collectively, all these things will increase the residual volume. Okay, what does that mean? It means now you have more dead space in the lungs, which means you have less space reserved for breathing, which means it will be difficult for gas exchange to occur. Okay, so you might seen on TV or even in real life, someone sometimes have to carry an oxygen tank with them to breathe, right? Okay, so that is as a consequences of perhaps emphysema. Okay, because they're not getting enough oxygen into their system because the remaining volume that's available for gas exchange is so low, right? Because the dead air is so high. Does that make sense? Please ask the question again if I'm not answering what you're asking. Everybody okay? Yeah, COPD, right? So yeah, I wasn't gonna mention that, but since you mentioned it, so COPD, right? Chronic obstructive pulmonary disease. That's basically emphysema. If someone has emphysema plus chronic means like ongoing, right? Chronic bronchitis, right? Then they meet the definition of having COPD. Right? So like if someone is a long-term smoker, number one, they damage all their cilia in the airway, and without the cilia, there's no good mechanism of clearing pathogens out of your system, so they can get inflammation and infection easily. That's why it's called bronchitis, and it's all the time almost. And along with that, with the emphysema, it makes it very, very difficult to breathe. Okay, and so you will see them wear the oxygen mask. Okay. All right. And so you just have to match the definition here, right? To see which definition match which one. I am just going to cheat here a little bit and see if I have the old answer and just put it on there. So it is DBCAE. No, that does not make sense. Yeah, no, that's the wrong answer. Okay, we'll just do it quickly then. Whatever. The maximum amount of air that can be moved in and out of the respiratory system in a single respiratory cycle. So, from the lowest point all the way to until you cannot breathe in again, that is going to be the vital capacity. Okay, D. Amount of air that could be voluntarily expelled at the end of each respiratory cycle. What is that? Anybody know what that is? Like the stuff that you can voluntarily breathe out.
Respiratory reserve volume.
That is correct. That is the B right there. Thank you. Amount of air left in the lungs after it bursts, after it collapses, that is the minimal volume. The amount of air that can be taken in and over above the resting tidal volume. So that extra bit of air that you can breathe in, that would be inspiratory reserve volume. Amount of air moved into or out of the lungs during respiratory cycle, just like, regular in and out, that would be the tidal volume, like the ocean tide, right? It comes and goes. Amount of air that remains in your lung even after maximal exhalation, that would be the residual volume, the dead air, the useless stuff that you don't want a lot of. Okay? That is that. All right, moving on. True or false? First one, the respiratory center in the medulla oblongata. So the medulla oblongata is part of your brainstem, right? You can learn that in lecture, 6, I think. It detects O2 level to regulate breathing rate. Is that true or false? That's right. This is false. It does not detect O2. It detects carbon dioxide, right? The diaphragm relaxes during inhalation to increase volume of the thoracic cavity. That is false. The diaphragm contracts. Okay, it contracts, it moves down, and it becomes flat. Right? Remember, the diaphragm can be dome shaped. That's the relaxed state. And then when it contracts, it flattens. Relax, flattens. Okay. Breathe out, breathe in. Breathe out, breathe in. Next, air rushes into the lungs when atmospheric pressure, so that's PA, is greater than PI. That's true. We talked about this. Right? When the pressure on the outside is bigger than the inside, air will rush in and you will be inhaling. Vocal cords are found within the pharynx. That is not true. It is found without the larynx. I used to be very confused between the two, like where the vocal cords are. And then I realized like LA, it's larynx, and when we sing, we're like la 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 singing, right? So to make sound, we need the larynx. Okay, the larynx, that's where the vocal cords are gonna be. Maybe that will help you, maybe it will not. The trachea is anterior to the esophagus. That is true. Okay, it's in front of it. According to Boyle's law, pressure increases when volume increases. That is not true. According to Boyle's law, pressure increases when volume decreases. And also, temperature is constant. Okay. The trachea, the bronchi, and the bronchioles are all covered with cartilage. That is false. No cartilage for the bronchioles. That's why they could collapse. That's why it's a danger during an asthma attack. The parietal pleura is superficial to the visceral pleura. That is true. Okay, it's outside of it, right? All right, let's fill in the blanks. These should be pretty straightforward. Common passageway for food, water, and air, that would be our pharynx, the throat. Opening that leads to the larynx, that would be the glottis, which is of course covered by the epiglottis. Okay, to prevent food from entering the larynx, hence the trachea. Vocal cords are found in, we just did that a moment ago, larynx. Mucus producing cells called the goblet cells are found in the lining of the trachea. The interior of the trachea is lined with epithelial tissue called, oh, this is a mouthful, it's the pseudo stratified ciliated columna. Right, so these are basically hairy rectangular cells that looks like it's multiple layers, but not really. Okay, pseudo means like fake. Okay? So it appears to be stratified, appears to be multiple layers, but it's not. It's just a single layer. Right? So pseudo means fake, right? The trachea splits into left and right bronchus. Gas exchange between air and food takes place at, sorry, oh, I read that wrong. Gas exchange between air and blood takes place at the alveoli. Surfactant is the oily substance produced by septocells to reduce surface tension in the alveoli. Couple more. The lungs are surrounded by double layer membrane called the pleurae. The outer layer is called the parietal pleura. And then the inner layer is the visceral pleura. Expandability of the lungs, compliance. The respiratory center is located in the medulla oblongata. Medulla oblongata. The carotid bodies are O2 sensitive chemoreceptors located in the carotid artery right here and the aorta. Okay, so as a backup, right, if the medulla oblongata doesn't kick in when there's not enough air in the body, then the carotid body will stimulate it to make sure you breathe. Total volume of air that can be voluntarily moved in and out of the lung is called the vital capacity. Loss of elasticity as a result of alveoli merging together. Emphysema. Condition where the lung collapses due to puncture, that's pneumothorax. Okay. Scary part is this could happen spontaneously, like out of nowhere. It could just happen on its own. It happened to a friend of mine. So just one day he woke up and he feel like pain on one side of his chest. He couldn't even get out of bed to get help. And then someone found him there and then called 911. Turns out he had a collapsed lung. Okay, that's that. Long answer questions and anything at all? Just very quickly, because we have to do the lab as well. So I just want to make sure that you guys are okay with these? Any requests? Since a lot of you are here, I might as well remind you now, than later. Next week is the test, right? The test is next Thursday. which means our next tutorial will be on the Tuesday. Okay, Tuesday 12:30. Okay, we'll do a review. I will post the review package after class. Okay, so any requests here?
Professor, test will cover unit 2, 3, 4, right?
Yes, the test will be 2, 3, 4. Yeah, the lab quiz though, it's 1, 2, 3, 4. Okay. Lab quiz is, I think it's already open now. And it's gonna be due next Tuesday as well. Okay. Okay, last call. Any requests here? 3, 2, okay, 12. Sure. Describe the effects of smoking on the respiratory system, include physiological change, disease. Okay, sure. We can quickly do that. Let's find a blank spot here. So I'm just gonna do like I think it's called like a mind chart or something. Okay, so smoking. Okay, so what does smoking do? Well, first of all, smoking is going to irreversibly damage cilia. Okay, so it's going to damage the cilia. And what's going to happen when you damage the cilia? Well, without the cilia, you will not be able to, cannot remove pathogens. Right? At least not easily, anyways. And so that would result in increased risk of infection. Right? So e.g. bronchitis, right? Pneumonia. Okay. What else can you not remove other than pathogens?
Secretions.
Mucus.
Yeah. So all that mucus, all that yucky stuff is gonna stay there, with possibly the pathogens trapped, and there's no way to remove the mucus. So the only way to get it out is to cough it out. So you will have smoker's cough, right? Okay, which it's like forcefully remove trapped mucus. Make sense? So you see, like smokers, they spit a lot, right? They cough and then they spit it out. That's because the cilia are no longer working. Like, I mean, it takes some time, right? It takes like years of smoking, right? If you smoke a couple times and then you stop, the cilia is not going to be dead yet, right? It's like constant smoking. That's what causes the damage. Another thing is it will you might not be able, cannot remove pollutants or allergens, right? Which means it will increase risk of asthma attack, right? Another thing is we talked about instead of damaged cilia, alveoli merge together. Right, all that cigarette smoke caused the alveoli to be damaged, and they will merge together. And when that happens, we are going to have a couple problems. Number one, we would have increased residual volume, which means decrease gas exchange. when the alveoli is merged together, you basically have less surface tension, which results in loss of elasticity, which means it's going to be difficult to exhale, right? So remember, the lung is stretchy, right? Like a balloon. You breathe, you blow air into balloon and you let go of the neck, air automatically comes out. But with a loss of elasticity, it's like blowing air into a paper bag, right? The air will hang around in the paper bag. They won't come out automatically. You kind of have to squeeze the bag for it to come out. So with the alveoli all merged together, you know, breathing out, it's going to take effort. It's going to be laborious. Okay. Also, smoking would be build up of carcinogens and mutagens, right? So things that could cause cancer, things that could damage your DNA, and of course, right, what that does is it will lead to increased risk of cancer. Okay. I mean, those are the main stuff. Right? Of course, we can talk a lot more about it, but I think that's sufficient. Okay. Great. Let's just quickly talk about the application question here. Okay, I'm just gonna paraphrase this. Basically, if you hyperventilate like that, if you do it like 10 times and then you hold your breath, you will be able to hold it longer than you normally would. Okay, and I explained this in class, but here is the short version of that. Remember, it is your medulla oblongata in the brainstem that detects how much carbon dioxide you have in your body. So there's a threshold here, right? Carbon dioxide threshold. If you cross it, then you would have no choice but to breathe. Okay, so what happens is, let's say you just, so this is CO2 level, right, in blood, and then this is time, right? So let's just say you just, you know, hold your breath now and not breathe. So if you're not breathing, then the carbon dioxide level in your body start to go up. The reason it does that is because you're performing cellular respiration, right? Glucose plus oxygen produce carbon dioxide and water. So if you're not breathing out, all that carbon dioxide that you're making will just stay in the blood and have nowhere to go, right? So let's just say you hold your breath right now, then your blood carbon dioxide level, let's say start here, will slowly go up, slowly go up, slowly go up. And then it hits the threshold, the level hits some magic number, right? Then your medulla oblongata will be like, you got to breathe now because there's too much carbon dioxide in the blood. And that will be the time where you have to give up and breathe. Okay, so that's how long you can hold your breath. If you hyperventilate, right, breathe in deeply and exhale deeply, then you are getting rid of more carbon dioxide than you normally would. If you do it for 10 times, your starting level of carbon dioxide will be lower than the normal amount. Okay, and so if you hold your breath now after doing hyperventilation for 10 times, your starting carbon dioxide level will be lower, and it will take a longer time to reach the threshold. That's why it will take longer before you feel the urge to breathe. Does that make sense? So what happens is, the question is asking you, if you do this and then dive into the pool and see how far you can swim, you know, is that going to be a problem? And the answer is yes, it's going to be a problem. Oh, one more time, please. Okay, sure. Which part? Like the whole part, Ahmed, or just the second part?
No, Professor, if you breathe 10 times, then I
Okay, so if you breathe 10 times, right? Breathe in deeply, exhale deeply. So when you exhale deeply, you are basically breathing out more carbon dioxide than you normally would. If you're just breathing regularly, let's say, you know, what, like 5 carbon dioxide comes out, right? But if you breathe in like deeply, like that, maybe like 10 carbon dioxide comes out, right? Okay. Those are just random numbers. Okay. The point is you're breathing out more carbon dioxide. So if you keep on doing it 10 times, then you're getting rid of more carbon dioxide in the blood. So when you hold your breath, your starting level of carbon dioxide is much lower than what it normally would have been. And so when you hold your breath, it will take longer for you to reach the threshold. Okay, it's not because you're getting extra oxygen that you are able to hold your breath longer. Is that you're tricking your body into not breathing by lowering the carbon dioxide level. Okay, so it will take longer to reach this threshold. Is that okay?
Yes,
Okay, great. So if you were to, if Melisandre here was to do this thing and go in for a swim and start swimming underwater, what's going to happen is she's going to black out. And that's because, remember, this does not increase the amount of oxygen that's in your body. Okay, it just, again, tricks your body into thinking you don't have to breathe yet, right? And when you're swimming underwater, you're actually using up more oxygen than you normally would, and you're using up oxygen that you don't have, right? And when you don't have enough oxygen going up to your brain, then you pass out. And when you pass out, the first thing your body does is inhale. And if you're underwater, you're inhaling water, and that could cause you to drown. Okay, so I don't know if you've seen these videos of like people doing free diving, right? Those takes a lot of training and to regulate their breathing and to train their body, and they could swim underwater for like very long time, like 2 minutes, 3 minutes, like crazy amount of time. But normally speaking, right, if we do it without training, we're certainly going to black out underwater, and it's not recommended. Okay, next one. Again, long story short, there's a kid who's being stubborn and he's holding his breath because his mom wouldn't give him what he wants. If you have kids, you would know, stubborn kids are very common. And what happens is he hold his breath and then he passed out, lost consciousness, okay, collapsed on the floor. And then the question is, should the mother call 911, okay, or we should just let the kid stay there and eventually he's gonna wake up. Okay, so what do you guys think? Do we call 911 or do we not call 911 in this hypothetical situation? Okay, call, don't call. All right. So probably you don't have to call, okay? Because when we hold our breath, that's a voluntary override of the breathing system, okay? So we can hold it. But like I said, once you cross the threshold, okay, your body will automatically take over. And when you lost consciousness, you no longer have that voluntary override, right? So once you passed out, once you lost consciousness, the first thing you do, like I said, it's inhale. So your body will automatically kind of reboot and you will start breathing again. And the kid's gonna wake up. Having said that, if this is a real life situation, I probably would be too scared and I would probably call 911. But theoretically speaking, we don't have to. All right. So that's that. Okay, let's do some more poll question. This one. Yeah, this one's a good one. Number 7. Go for it. Okay. Let's take a look at this. Vital capacity is 6,000. Tidal volume is that, so on and so forth. What is the IRV? So the formula we have to use is this one. Vital capacity, which again is the total volume of air that you can move in and out by yourself. It's IRV plus tidal volume plus ERV. So that would be 6,000 equals to unknown plus 500 plus 1,000. Okay, total lung capacity is irrelevant in this case. So that would be 6,000 equals to IRV plus 1,500. So if you move the 1,500 to the other side, it will be 6,000 minus 1,500. So the answer will be 4,500. Okay. Last one.
Professor, a little bit zoom out, please.
Oh, sure. Look at that. Okay. Dawn is not able to produce surfactant. Surfactant allows the lungs to expand. In order to inhale a normal tidal volume, what must happen? So it's difficult to expand the lungs. Therefore, she will need to inhale more forcefully to lower the intrapulmonary pressure, right? She needs to basically breathe in harder in order to counteract that resistance. So the answer is A. Okay, everything else is not correct. Okay. Before I forget, let me just post the well, it's on eCentennial anyways, but in case you haven't seen it, that's the link to the test review number 1. Okay, so you guys can click on that and see if you are able to get to it. I'll post an announcement for it as well later on. Okay. All right. Quick polls. Have you worked on the lab yet? Okay, let me stop sharing and have you worked on the lab yet? If you have done it, choose A. If you have not, choose B.
Professor,
Mm-hmm.
our next lab, it will be the same is an online lab?
The lab is okay. So the lab is like this PowerPoint thing that you're supposed to do, right? That's the lab. Okay, but it's not worth any marks, right? We're doing the lab so that you can do the lab quiz. Okay, and the lab quiz is 2.5%, and it's based on the lab. Okay, does that answer your question, or
Like, is it will be the same thing in the lab?
you mean the lab quiz? Is the lab quiz going to be the same thing as the lab? Is that what you mean?
Yeah.
Okay, yeah. So some of the questions will be based on the diagram. Okay, but there will also be regular multiple choice question as well. Okay, so not exactly the same, but you know, a big portion of it would be based on it. Okay. All right. So I see that only 2 people have done the lab, which I wouldn't, which is okay, I guess. But I don't want to take it up if a majority of you haven't done it yet, right? The whole point is for you to go through it yourself, so that you would have a set of answers to yourself. Okay, so I would encourage you to do it.
Professor,
Yeah. Go ahead.
I'm sorry, I have written the answers on a rough paper with myself. Is it okay, or should we have to put answers on the PowerPoint?
No, it's okay. But again, right, like you do not have to hand this in, right? Okay. So you just do this for your own purpose, for your own record, right? Okay. You're not handing this into me. So whether you do it on a separate piece of paper, do it on the computer, it doesn't matter, right? Okay. But you have to go through all these questions and make sure that you have the answers to it. Okay. So you know what? I will not take it up now. I will let you guys do it on your own. And if you have questions about a particular slide, then you can contact me. But I want to emphasize the fact that you need to do these questions before you attempt the quiz. The quiz is available now. Let me share my screen with you. Okay, so if you go to assessment quizzes, okay, you will see all these are all the self quiz, but quiz. Oh, some people have already done it. Okay, fantastic. But it will be available. It was available like 2 days ago, actually. It will be available until October 4th. All right. And there will be 2 attempts, and the best one will count. Okay, but the questions, like I said, is going to be based on these things. Okay, so make sure you do your own. Just answer the question, write down the answer, and so you will have some reference to refer to when you do your lab quiz. Does that make sense?
Professor, you just shared that online quiz solution. Can you please submit for our practice?
I just share with you the PowerPoints. You mean the answer key?
Yeah.
Yeah, well, but like I said, right, the whole point is for you guys to do it first, right? Okay. So because only 2 people have done it, I don't want to take it up at this point. I really want you guys to have a chance to go through it first. Okay. And then if there are slides where you're not sure what the answers are, you can email me and let me know. Okay. All right. So I will see you on Tuesday, everybody. And on the Tuesday, we will take up the test 1 review, which is this document. Okay. Like, I mean, you can try it out first, or you can wait and we'll take it up together. Okay, whichever you prefer. Okay, but this one we'll take up on Tuesday, and then you will do the test on Thursday. All right. Okay, that's it for now. Thank you, and again, see you Tuesday, 12:30. Bye for now.